We are a group of 4 small hospitals around this Bay of Quinte, a beautiful area. One of the reasons so many of our staff work there. The city that I'm in is 50,000 people. I like to call it the biggest little town in the world. Everyone knows everyone, even in that size of town. The other smaller hospitals are satellites, 20, 30 miles away, with one maybe 90 miles north of us, just a small little cottage hospital. Sectra PACS, we went to after we'd started originally with Philips, and we made the right choice, followed along with Sectra. We've been very happy with them. I believe it's since 2007. I think the original PACS system went in 2005, so we just got settled in and then flipped over. Sectra made that amazing, the change, and I came on board probably 2011. And so I've been at it almost 7 years now, and find it very easy to work with. Love the guys. When you say it's user friendly or it's easy to work with, that's really big. The people that use our system, they want it to work right away. They want it to be fast. They want it to, and they're getting what they want. We have the unique problems of being fairly widespread and still not being a large hospital system, even amongst 4 sites, and they have helped us through all that. We do use an off-site central archive that is shared with 1/7 of our province. There are 7 archives, and we've integrated into that, and we use that as our backup, and we can also get prefetching from every other donor or contributing hospital or healthcare facility that's in there. So it's helping us get closer to a one EMR system as far as our imaging is concerned, and it's certainly our radiologists love that. It is very true that we don't have as much staff as we used to have, and Sectra has filled that void for us in many respects, and of course we're grateful for it, and we've learned to rely on them. Sectra is different in that the software itself is very intuitive, very easy to use. It has all the bells and whistles that my radiologists demand, my orthopedic surgeons demand, but it's simple. There's not a big learning curve for them in the front end. I find it fairly easy to service from the back end. And as I said, the real differentiator is when I'm stuck. I'm not stuck for very long because I just call my SE, and he's got it straightened out. I know that my Sectra rep knows half of my radiologists. If there's something that I'm having trouble with or I'm not there, my Sectra rep will work with them and get it straightened out right away. And I think that's something that I see missing in a lot of businesses right now, that the level of customer service. I mean, I've had people say, well, that's not really our thing. Well, I've never heard that from Sectra, ever. I think Sectra has always managed to innovate with the market. I know that when I see a need coming along or a challenge ahead, I come to Sectra and I say, this is where I see us going. They say, yeah, we're working on that. They really have their fingers on the pulse of the business, and I think they're ahead of the curve, because we've tried the mix of best of breed and in the end, more and more, Sectra is becoming that. So it's really great that we can go back and say, oh, you've got that, and it works better than what we've been trying to kludge into this mess that we have. And so, as moving forward, the more we can incorporate into a company, particularly like Sectra, it's going to be great, and it's going to be cost effective, and we're going to have some happy users.
I work for 2 organizations. I work at Thunder Bay Regional Health Sciences Center, which is an acute care facility. We offer outpatient programs, inpatient programs. Renal program is one of our high volume programs, as well as we have the regional cancer care, our cancer center. Also, I work for St. Joseph's Care Group, which is a long-term care facility, also providing mental health and rehabilitation services. So our systems within the hospital, we also integrate physician offices. So any information that happened, any visits for patients that come through our system, we can use our HIS system to send reporting back to their offices so that they can get them in their office for follow-ups with the patients. So we utilize Sectra PACS from a radiology perspective. We use it in our cancer program. We use it for mammography. We use it for MRI, CT, ultrasound, and nuclear medicine. Our connection between our EMR and our PACS is we don't have a RIS, so we're a non-RIS site. We utilize Meditech client server. So our Meditech client server integrates with our Sectra PACS via an ordering system. So you initiate an order in Meditech, flows through to PACS, images are acquired with the modality, radiologist does the reporting in PACS, gets sent back through to Meditech, and then any physician and or nurse or practitioner can view the results in our EMR. What I found with our Sectra PACS system is that it just works. We don't have a lot of issues. When we do have any issues, we report them to Sectra. They're handled immediately and or escalated to an engineer. It's one of the pieces of software that when we put it in, it's rarely the software that's the issue. It's typically a user issue. It makes it easier on our support side because we're not having to worry about the product or worrying about training, retraining, re-education. It integrates very well with our Meditech system, so things integrate seamlessly, and it's got visibility for our users, from end to end, and really from a standpoint of getting the information in front of our caregivers as soon as possible. We're an organization that focuses on patient, family-centered care, and I'm sure most hospitals are of the same mindset, but we really emphasize it. We're a leader in Ontario for PFCC, and so having these products that help us get that information to the caregivers is beneficial for the patients and families. Sectra is great for just being a resource. We give them a call and we want to bounce some questions off them. They'll help us out. Our team has a very good relationship with the support staff. We know people's names. We have a tight relationship with them. And from us, for our perspective, when we bring them feedback, they listen. And sometimes it's harsh feedback, but they listen, they take it, and they acknowledge it, they own it, and they'll try their best to address it. So technically, I think they're staying current. They're constantly refreshing their product. We've got an annual upgrade schedule with them so that we stay current and that it keeps us on one of the most recent versions, getting that functionality out to our users, and they're constantly refreshing their product, which is a good thing, so that they're fixing the things that don't work. They're using the user feedback to change things that we're like, no, that was bad, fix that, and they're staying current with the new and emerging technologies, and they're always integrating new modalities. They're always integrating with new types of functionality. So we have all these pieces that we need just to align so that we can provide our care. And from a technology standpoint, our couple big systems are our cancer care system, our imaging system, and our EMR. And we need them all to work together. We need them all to work now. And the Sectra product is 1/3 of that circle. We have many other products, but those are our three big ones. And the PACS system just works. It's peace of mind.